In the US, a drug called ivermectin is being touted as a way of treating and preventing COVID-19, despite a lack of evidence to back this up. Let's begin with one of the world's most popular podcast hosts, Joe Rogan.
Turns out I got COVID. So we immediately threw the kitchen sink at it. All kinds of meds, monoclonal antibodies, ivermectin, Z-Pak, prednisone, everything.
Ivermectin is cheap, it's widely available, its makers won the 2015 Nobel Prize for Medicine for how it treats parasitic diseases in humans. It's also used as a dewormer for horses. And the advice from the US Food and Drug Administration, the FDA, is clear. It says while there are approved uses for ivermectin in people and animals, it's not approved for the prevention or treatment of COVID-19. But by the end of August, the FDA's language had evolved. It tweeted, "You are not a horse, you are not a cow. Seriously, y'all, stop it." Its intervention was prompted by an increase in sales of ivermectin. This is one pet shop manager in Texas.
We typically sell maybe 10 of those a month, but in the past month we've probably sold 50 to 100 of each. We don't know that that's what they're using it for.
Evidently, though, the FDA has a theory. So does NBC's Ben Collins. In a Twitter thread, he promised to explain how people started eating horse goo. He wrote, anti-vaxxers started imploring each other to go to pet stores, claiming the horse and people ivermectin are the same. He goes on, they started sharing tips on how to eat the gel kind. They started hoarding it. The gel kind being what's called equine paste dewormer, which comes in an apple flavour. And look at this. According to the US National Poison Data System, there was a 245% jump in reported exposure cases from July to August. In other words, these are people who've taken ivermectin and become ill. On that, the FDA says this.
We've identified multiple concerning cases of patients who required medical treatment and were hospitalized after using ivermectin products to treat or prevent COVID. Some of these products were intended for animal or veterinary use, and others were products intended for human use.
It seems either the distinction between the products for humans and animals is not registering, or some people don't mind. And to understand why ivermectin has become bound up in the pandemic, we need to go back to last year. First, to this study, published in April. It showed that high ivermectin doses prevented the virus from being replicated in test tubes. But, and this is a big but, researchers didn't test the drug for treating or preventing COVID-19. But for some, though, that planted a seed of an idea. Next, we jump to December last year and to Dr. Pierre Corey, founder of the Frontline COVID-19 Critical Care Alliance. Here he is speaking to a US Senate committee.
You look at these safe and low-cost agents, it seems like a no-brainer that you should try it. We have this data. It's showing that we have an effective treatment against this pandemic.
But as we've been hearing, the authorities say there is no such data. But Pierre Corey's alliance has been a prominent backer of ivermectin. A number of its doctors have appeared in the US media. These pictures are from Texas in April. The alliance claimed that ivermectin has high activity against COVID-19, despite there being no clear proof that it does. And Pierre Corey was interviewed by conservative news outlets, including Fox News. And then this was in June. Spotify's big signing, Joe Rogan, also interviewed Pierre Corey, who described himself as the world's foremost expert on ivermectin. It's fair to say that assessment isn't universal. But by the summer, the message about ivermectin was having an impact. Google searches for the drug were increasing, and people were turning to online health services, some of which had connections to a group called American Frontline Doctors. If that sounds familiar, they were the people behind this video, which Donald Trump retweeted last year. It promoted hydroxychloroquine, another unproven drug for COVID-19. But despite the lack of credibility of those promoting it, despite the lack of evidence, this drug is still being publicly endorsed. One recent example is Australia's former Wimbledon tennis champion, Pat Cash.
We've been taking ivermectin since the beginning of the year. I've been taking it for over a year and a quarter now. We know it works. We know that it's a medicine, and this is not. Oh, go ahead, fact check me, all you like.
OK, I will. That's not true. We don't know it works. Pat Cash went on.
I'm living proof that I've been in the worst areas everywhere around the world, and I haven't come close to getting COVID.
That, though, is Pat Cash's experience rather than proof that the drug works. But his perspective is mirrored in the US, where demand for ivermectin remains. Here's the Chicago Sun-Times with the headline, "Angry QAnon backers want hospital to treat supporters COVID-19 with unapproved drug." The hospital says it was bombarded with calls. The patient, who was an anti-mask campaigner, has since died. But this isn't just about people making demands of doctors or going to a pet shop to buy dewormer. Some doctors appear to be on board. Data for August shows that over 88,000 prescriptions for ivermectin were written in 1 week. Typically, 3,600 are given. That appears to be doctors prescribing the drug, despite the FDA's advice and despite available research suggesting no benefit. On that available research, the New York Times tells us a recent review of 14 ivermectin studies concluded that none provided evidence of the drug's ability to prevent COVID, improve patient conditions, or reduce mortality. We're also told another 31 studies are still underway. Or there's this statement from the company that makes it. It says there's no scientific basis for a potential therapeutic effect against COVID-19 from preclinical studies. That, though, is not enough for some. And it's clear that many of those who are turning to ivermectin despite a lack of evidence are turning away from the COVID vaccines despite a lot of evidence. Aaron Blake of The Washington Post explains.
The people who have pushed this the most strongly are a pretty familiar cast of characters. They're many of the same people who have been casting doubt on the efficacy of the vaccines or the safety of the vaccines.
All of which means that as case numbers in the US have risen through the summer, so has demand for ivermectin. It's a story about Americans' response to COVID, but it's also a story about the erosion of trust in politics and in science, and how that erosion has led some Americans to conclude that a horse dewormer is their best chance of fending off the virus.